Hi everybody, this is Matt. Thanks for watching and welcome back. Well, several years ago, I suffered what doctors call a silent heart attack, which means that I had a heart attack but didn't know it. I did not have any, or didn't sense or feel any of the typical classic symptoms of a heart attack, which is extreme pain in the chest, pain radiating up the neck into the jaw, coming down predominantly the left arm, or the sensation of extreme pressure on the chest like an elephant trying to sit on you. Didn't have that. And how did I find out about it? Well, about a year and a half ago, I ended up in the emergency room and I had a heart attack. So I had open heart surgery, a quadruple bypass. Upon being fixed back up and wide awake, my cardiac surgeon, who was absolutely awesome, by the way, the best surgeon, frankly, I've ever dealt with in my life, he came to me and he said, "Matt, did you realize that you had a heart attack somewhere maybe between 3 and 5 years ago?" And I'm like, "What? Heart attack? No. Why?" Well, apparently, the back artery on my heart, so the main artery at the back of my heart, was 100% blocked. There was scarring, which meant muscle damage, and it had been there long enough that the artery was actually growing blood vessels around the blockage. That really disturbed me. Now, I think it's kind of cool that our bodies, will try to do that, like growing the blood vessels around a blocked area. That's awesome. But the fact that I didn't realize that I had had a heart attack really disturbed me, because I try to be in tune with my body and what's going on with it. This one I completely missed. So we ran through a few scenarios and nothing immediately came to mind. And that just really troubled me. So eventually, upon thinking about it, I only come up with maybe a couple of things that could have been warnings. And I guess silent heart attacks are extremely common. They happen to men and women alike, and they can kill. You can go to bed thinking everything is as right as rain, and in the morning, you just simply don't wake up. So in my situation, I had been leading an active lifestyle. I would get out, I would walk, I would go to the gym quite frequently because it was only about a block and a half away from my house. So I would be on the treadmill, I'd be on the bicycle, I would be lifting weights, I'd be doing lat pull downs. Plus, I did martial arts. So I was in the martial arts dojo for about 4, sometimes 5 nights a week. I was busy and I was trying to stay healthy. What did I notice? Well, in reflection, there were times where I would be outside walking, and a lot of times this would be in the colder months. I live up in the northern part of the United States where we get winters, and I like to go out and walk on a cold winter's day. Now, I'll wear a mask and things like that, or some kind of a scarf across my face, but I still like to go walk. I noticed a couple of times that it felt like things were tightening up a little bit. Well, I attributed that to cold air. I really did. I don't remember ever experiencing something like that when I was on a treadmill, though. That's the weird thing. The other thing was my pulse rate. When I would be at the gym, I would be tracking my pulse rate because for one thing, the cardio machines all had the pulse rate detectors, and I would get up into the aerobic zone. For me, a good zone to be in would be about 138 to 144, and I would get my heart rate up there, and I would keep it there for about 20 minutes, right? Well, after I was done exercising, I'd go through the cool down, and then I would finally sit down to relax. My recovery rate, meaning how fast your heart returns to a normal beat, didn't seem right. And I could be at 144 beats per minute, and after my cool down and sitting there, I could be there 10 minutes later and my heart rate is still like 132 after 10 minutes, and after a half hour, maybe 120, maybe 110. It kind of sort of varied, but that was something that struck me as being just a little bit odd. But I thought, well, I'm getting older, I'm into my 50s, I'm getting older, maybe these things change. Never really thought about asking the doctor about that. Upon reflection and conversations with cardiologists, that's one thing that could have been a reason to go to the ER and have it checked out. So basically, silent heart attacks do happen. It happened to me, which means, unfortunately, it can happen to you. But those are the only things that I can think of that really come to mind. The main one being the lack of the recovery on the heart rate. Because coming out of a dojo after you've been sparring and stuff like that, it just seemed to take forever for everything to, kind of calm down and get back to normal. And for me, right now, as I'm standing before you, it is not uncommon whatsoever for my typical resting heart rate to be 55 to 60 beats per minute, sometimes 63 beats per minute, and my blood pressure is normal. That's the other thing. I had normal blood pressure before my heart attack. I have normal blood pressure after my heart attack. Actually, my blood pressure today can be a little bit on the lower side of things, but that generally keeps the cardiologist happy. So anyway, if you think that something is different in your body when it comes to your heart, when in doubt, have it checked out. Because my cardiologist did bring up one thing. He said, Matt, because of the fact that the blockage occurred at the back of your heart, the artery involved was at the back of your heart, he said sometimes that might have felt like indigestion, and people can mistake it for indigestion. Well, he's a doctor, I'm not, but you know what? That made perfect sense to me. Now, I don't go around remembering when I feel indigestion from time to time, but like I said, when in doubt, have it checked out, because you know what? Your life is worth it. I hope this helps. I really do. Stay active, but be in communication with your doctor. So anyway, like I said, hope it helps. Thanks for watching, and may each and every one of you enjoy a happy life, good health. Take care now.